Okay, it's 10:30, and I always say a 10:30 show is a 10:30 show, right? Thanks for the folks who are here early, too. And thank you all very much for coming. So here we are exploring health careers of the future. There's so much to talk about and so little time, but I wanted to start by asking, how many people here have ever participated in a video conference? Oh, well, let's do this again. I want to turn this camera around. So, how many people have participated in a video conference? There you go, there you go. That's quite a few people, which is excellent. My name's Janet Major, and I have the opportunity to provide technical support in healthcare. I put the tele into telemedicine, and I get to work with a lot of really great doctors and nurses. Now, healthcare isn't all about doctors and nurses, right? There's still some great seats down here, 3, 4, 5 seats down here. They're not the cheap seats either. People pay top dollar for these seats. So I'd like to talk to you today about a lot of maybe non-traditional careers in health. Everybody's heard of doctors and nurses, but there's so much more that you can do. And now we are doing so much more healthcare at a distance. And how do we do that? With technology and telecommunications connectivity. It takes bandwidth, right? To do everything that we want to do on the internet, to do video conferencing, to talk at a distance, to send healthcare data at a distance. That's what it takes. So that means it takes people like me too, and IT people and people you might not have thought about who work in healthcare. So this is where I work at the Arizona Health Sciences Center. And this is who we have there: the College of Medicine, College of Nursing, College of Pharmacy, the College of Public Health. We have a beautiful library that's all about the health sciences. And then we also have Banner University Medical Center, and they have locations all over Arizona, and it's a national company as well. So how many people here knew that the University of Arizona has a College of Medicine in Tucson and in Phoenix? You knew about that. Well, we're going to go there this morning. We are going to take a brief trip to downtown Phoenix on Van Buren, and you can see it right now on the screen, the T-Health Amphitheater on the bottom right. First, we're going to talk a bit, and then we're going to take a whirlwind tour of a classroom that's live in Phoenix, Arizona. You can go to Phoenix without even driving. And that's what we do. People now want to be connected on their iPhone, on their iPad, at their desktop. People really don't want to have to drive for healthcare if they live in some remote places. And the fact is they really don't have to. There's so much that we can do at a distance. And my job also includes not just providing support for healthcare and healthcare at a distance, but also training. The work that we do helps train the healthcare workforce of the future. And that's what I'd like to talk to you about as well. So doctors and nurses, we know that they go to school for at least 4 years, 6 years, 8 years, 10 years, 12 years, right? Well, they need a whole team of people like you and me to support that. Now, I've already met today 2 wonderful students, one who said she wanted to be a nurse, another who says she wanted to be a trauma surgeon. Well, fortunately, I don't think I could ever be a trauma surgeon. It's not my cup of tea, but fortunately, there are other people who'd like to do that. But what I've done with my friend and colleague who's a trauma surgeon was I supported his use of Google Glass. So we have a trauma surgeon who's used Google Glasses to train people without having to take them into the emergency room or the OR with them, because we can't all go in there. So there's a lot of things that we can do. There are now also, when you think about healthcare workforce of the future, there are family nurse practitioners, there are medical assistants, there are a lot more healthcare providers, but there's also a lot more people who provide technical support. New jobs of the future. So when I think about health careers of the future, I don't necessarily think about doctors and nurses. They're always going to be there, and they're always, fortunately, going to be people who are drawn to that path in terms of their career. But fortunately for you and me, there's something for everyone in healthcare if this is a career path that you should choose. So IT specialists. People have to support the technology for video conferencing like we're doing today. I actually had to call the IT help desk here at the Student Union because I had a hard time logging onto the network. My laptop didn't recognize me for some reason. But with a little troubleshooting from a wizard downstairs somewhere, an IT guy, I was able to get up and running on network. So we need network people, we need technology people, graphic artists. That might be a career you hadn't thought about in healthcare. Graphic artists actually do a lot in healthcare. Photographers, we have certified biological photographers who do dermatology. Videographers, we don't let just anybody in the operating room. We have to sterilize our equipment when we go in there. If you see news stories on Channel 4 that's video from our OR, that was shot by our Department of Biomedical Communications. And then we make copies and release it to the media. We can't just let anybody in there. There's a sterile field of view that we have to be aware of. So there are a lot of great jobs you might not have thought about, and of course, technicians like me, my favorite job. So now a little bit about T-Health Institute. Now this T-Health Amphitheater you see on the bottom right, I'm going to turn on my microphone so Chris knows we're just about ready to get there. This T-Health Institute is used to help produce a lot of the educational events that help train our healthcare workforce of the future. And I would like to introduce you to the person who manages that room, my colleague that I get to help co-produce some of these events with, and that's Chris Martin. He's the Assistant Director of T-Health, and he's going to take just a few minutes to show us around the room. You can see the audience part, and he'll also show you the front of the room where the screens are, and there's Chris now. Thank you, Chris.
Hello. Like Janet said, I'm Chris Martin. I'm the Assistant Director of the T-Health Institute. And actually, Janet, can you keep the PowerPoint up? Or does that make me small?
It makes you very small. We'd rather see you do it.
Okay, well, you can leave it there for now, but
thank you.
When I show the video wall, I wanted to show how it looks. But so I'm on the College of Medicine Phoenix campus in downtown Phoenix. And so right now you're looking at the front of the T-Health Amphitheater. So this room we do this is College of Public Health, College of Nursing, College of Pharmacy. They use this room for their master's programs. So there's students in Phoenix and then plus students in Tucson. So the instructors either here in Phoenix or are in Tucson. And the students at both sites receive the curriculum over video conference. So let me just show you the front of my room. So camera. So I'm controlling all this through the touchpad. So that is what, so go ahead and throw your PowerPoint up, Janet.
Okie dokie.
Just real quick. So what you're seeing is 6 80-inch screens. And so bottom left screen, bottom right screen are usually the remote sites. And this, what's running this room is a C90. So I can bring in multiple remote sites. And if there's more than 3, if there's 3 sites, each screen is a site. So they're full screen. And then the content usually thrown up on the top screens. So what's great about this room is that usually in a video conference room, so say you're in a video conference room right now, there's usually microphones that are coming from the ceiling or just placed throughout the room. And the microphones are usually on in the audience. And so I can see everyone, I can mostly see the people in the front, but people in the back, it would be kind of hard to hear you, kind of difficult to see you. So it would, well, actually, I would be able to hear you because the microphones are right above you. So like any little conversation, so say you're in the back row, you're talking to your friend in the middle of class, say the instructor's not there locally, say they're at the remote site, so you kind of feel more freedom to talk in class. So say you're talking to your friend and you're whispering, and actually no one in the room that you're in can really hear you, but those microphones in those rooms will capture every word you say. So the students in the other remote site can hear every word you're saying, even though you're just whispering in that room. So students like this room because of how we have our microphones set up. Let me just show you real quick. So my microphone was muted until I used a button to press to activate my microphone. And so each student has a microphone in front of them. They have their touchscreen right in front of them so they can activate themselves. So it's add to queue. So say someone speaking right now has full control of the floor, can talk, and all other microphones are muted. So say another student has a question, wants to interrupt you, they press their add to queue, but it's not activated until you end your session. In session, it just goes right to the next seat, whoever activates their microphone. So that's one of the great things about this room that I like, that students like. Sometimes they have, like if you're not used to video conferencing, you saw the 6 80-inch screens. when you activate your mic, it zooms in on you. So it's a little difficult to get used to seeing yourself full screen up in the classroom, but as the semester goes on, students usually get used to that. But along with College of Public Health, nursing, all those, we do our monthly training in this room, and then other telehealth events are held in this room to bring in remote sites other than just Phoenix participants. So that's just a brief overview. Is there anything else you wanted me to cover, Janet?
No,
or show?
Does anybody have any questions for Chris? Like, how hot is it in downtown Phoenix today?
I don't know. I haven't been outside.
I bet you it's 80 degrees. I bet you.
My phone says it's 70 degrees, so.
No, your phone's lying. Well, thank you so much, Chris. We really appreciate
You're welcome.
the opportunity to visit with you. You know, one other event that Chris produces, which is really pretty cool, is a Jeopardy game. So by having people seat at all of those microphones, you can play Jeopardy, because whoever hits the microphone first gets to answer. If they miss, then the second person who hit their microphone gets to do it. And even though it might sound silly playing games in education, games are fun. And the fact is, if you turn learning into a game, everybody wants to win, right? So the Jeopardy games are based on medical Jeopardy questions, and it really is a lot of fun. So thanks, Chris. We'll see you again around 11:30. I'll leave my mic open. Okay, so now let's go back to the PowerPoint. So I think about health careers of the future, and I think about that from my perspective in connecting future communities. I would imagine that in the future, as we build communities, they will have a lot of infrastructure already. We will be buying homes that have smartphones, smart homes that turn on and off lights that are programmable. I would imagine we will also have not only network connectivity through the neighborhoods that are being built in the future, but we would also have access to healthcare in the same way. Maybe we could turn on our TV and see a nurse. There's a lot of different things that are going to be happening as we work towards the future, which will all involve technology and bandwidth. So there will be some great new jobs coming up as well. So today, I'd like for you to please take the opportunity to meet some of the folks who are here. Pima Community College has a great table, and they have an amazing amount of health careers. Some take 6 weeks, some take a year, some take 2 years. I saw today on one of the tables, they have a position advertised, and I'm sorry I didn't ask how much education it takes, but it'd be really interesting to find out, a clinical research coordinator. Now that's an important job. People who help collect all this data of all this amazing research that's happening at places like the University of Arizona. Health information technology, that's a good living. People need to be, it's out of my area of expertise. My husband will tell you I have no skills when it comes to managing budgets and money. But it does take budget and money management to also make healthcare happen. So it takes a lot of wide variety of skills in the healthcare world. Another great table that was mentioned, we were asking people what was their favorite exhibit so far, and some people said JTED. So the Pima County Joint Technical Education District has all kinds of great jobs. They have so many jobs that they didn't fit on my screen. Now they do courses in mechanics, they do courses in firefighting, all kinds of stuff. But look at all the things they offer in the world of healthcare. An emergency medical technician, certified caregiver, licensed nursing assistant. Now at Pima College, you can also be a licensed practical nurse in just 2 years. What a great way to enter into the nursing field if you know that that's something that you want to do. The College of Nursing here at the U of A offers a doctorate in nursing, and some of that's online. So there are a lot of great possibilities if you know that that's what you're interested in. But it takes everybody, physical therapy technicians, radiology technicians. Now that's an interesting job. And then also make sure you make it a point to visit those people at Banner University Hospital. They've got several tables along the end of the room where you walk in. And those are also, there are some doctors, some nurses, but there are also some great technicians there and people who would love to talk to you about what you are interested in the healthcare field. So these are incredible resources you have at your fingertips today. And I hope that you'll take advantage of that. And I hope that your doors are wide open. And more than anything, I sure hope when you think about the future and how we're using technology and telecommunications connectivity to make the world a smaller place, if these are things that you're interested in, I suggest you go for it, because the fact is, you need to find something. My best advice, I think, for you today is to find something that you love to do and make that your career path. We spend so much time at work that if you can find something that you're really, really interested in, now that's the way to make a living and have a job that supports your life and not a life that's supporting your job, right? So please do, as you go forward today, go Wildcats. Take the opportunity to talk to everybody out there because that's why they're here. So does anybody have any questions? Yes, no? I guess we did pretty good on time then, huh? What time is it? Seriously? No, we still have 15 minutes. So what do you want to talk about? Anybody think of any other interesting health careers that I didn't mention? What are some other health careers? Respiratory technician. Yeah, it is. And you know, we have a wonderful doctor who wrote a grant to screen asthma patients at Tucson schools. And this poor doctor was driving all over town. Well, that's not efficient. Technology should help us be more efficient in what we do, right? So we set him up with a laptop, the same echo cancellation microphone, an off-the-shelf Logitech camera like this, and a Bluetooth stethoscope. Now all of this stuff fits in a backpack along with a hotspot for connectivity. And now his nurses go to the schools, to the nurse's office, and they set up that equipment and they don't have to interface with the school's network because they bring their own network. They bring all their own technology, and he can stay at his desk across the street on Speedway in the Health Sciences Center. The pediatric pulmonologist, well, this guy went to school for many, many years to specialize in pediatric pulmonology and to screen kids for asthma, and he can do it much more efficiently because they have this nice backpack full of technology. The nurse's office supports the project. The nurse from his office goes there, and he's at his desk doing exactly what he was doing, only he's not driving all over town, which is a great example of how we can use technology to be more efficient in what we do. Any other jobs? I think radiology technicians are amazing. I think it would be very interesting to work with people, feel like you're providing a great service because you're helping patients, and take x-rays. I think that's fascinating. I don't know a lot about it, but I think it'd be a great career. Any other careers you can think of?
Doctor.
Being a doctor?
Yeah, OBGYN.
OBGYN. Now those are doctors that are really in high demand. You know, there are places in southern Arizona where there are not a lot of OBGYNs. So pregnant women often have to travel for their help. There is a great project that we do in Yuma, Arizona, where we take the output of a fetal ultrasound. So a pregnant mom who may have a high-risk pregnancy can be reviewed by a specialist here at the Health Sciences Center by taking the output of that fetal ultrasound, connecting it to the input of a video conferencing unit, and we help triage that baby and that mom. If it's identified to be a high-risk pregnancy, she may be recommended to be transported to Phoenix or Tucson. Well, depending upon what the issue might be, would depend upon where she's told to go, Phoenix or Tucson. The other thing we can use that video conferencing technology to do to support OBGYNs is we also help determine who should staff that helicopter if that patient is transported. So what a great application. You don't want to be pregnant and be in the bottom of the Grand Canyon, right? But if you've got access to video conferencing technology with Flagstaff Medical Center, you can feel a lot better about that pregnancy and a lot safer knowing that you can always connect to someone and not go anywhere unless you know you have to. So there are great ways in which OBGYNs get support from telemedicine. We also did a really great project with Campus Health as well as Nogales Mariposa Medical Center where we took JPEG images with a video colposcope. So women have to have a Pap test, and some of them, if they fail their test, they have to go for a colposcopy, in which there's a special scope that's used to view the cervix. So we did a great study. I called it the Real Memorex study. So would the OBGYN who saw the patient live and in person with a video colposcope, would they take their biopsies the same place as an OBGYN who only saw the JPEG images we took with this camera? And the answer was yes, and that's great news. So a woman wouldn't have to travel just for colposcopy. And same thing, this is a project with the US Army. So their take in the whole project was, could we keep our female soldiers out in theater to do Pap tests, and if they fail their Pap test, do their colposcopy in theater out in the field, as opposed to making them travel So there are a lot of there's a camera for every occasion. There are wonderful ear, nose, and throat scopes that we use with school nurses. Because how many people here have ever had an ear infection? And what did your pediatrician do? Gave you antibiotics, right? Well, the course of treatment for ear infections is antibiotics, and they have to scope your ear or they can't prescribe them for you. So to be able to have an ear, nose, and throat scope in the nurse's office means your mom and dad wouldn't have had to leave their work to pick you up to take you to the doctor. If the nurse could scope your ear and the pediatrician then could give you a prescription, then you wouldn't miss school, your parents wouldn't miss work, and you'd be getting the exact same course of treatment just by use of video conferencing and that wonderful camera. And the other great example of that type of application is teleophthalmology. How many people have had their eyes dilated when they go to the doctor? So we have an incredible camera that a great technician like me can use to take 3 images per eye of your optic nerve. Those images, along with your patient medical history, are sent to the U of A ophthalmologist at 5th and Alvernon to screen for diseases of the eye. Well, we can screen for the exact same diseases of the eye without dilating your pupil because the camera blasts light. So rather than traveling from a remote place to have your eyes screened, we use this in the Tucson prison too. So if this camera can take images and be sent to the ophthalmologist, this is called a store and forward application. The ophthalmologist, when it's convenient, reviews those JPEG images in your patient medical history and can diagnose for the exact same diseases of the eye as if you walked into the clinic and had your eyes dilated. It's a really wonderful application. I've got a picture of my eyeball on my display if you're really interested in looking at the images, and you can see the optic nerve. So my display is right where you come in the door by Banner Health. If you're interested in telemedicine and telehealth, there's a lot more information there. I also have an electronic stethoscope set up if you'd like to listen to your own heart sounds. It's the same stethoscope that was used to monitor the astronauts on the space station. Now stethoscopes are wireless and Bluetooth enabled, and it's a really great application to be able to share heart sounds hundreds and thousands of miles away with your doctor, so that if you need a pre or post-surgery follow-up that would take 5 minutes, all you have to do is connect that stethoscope, and rather than travel down from the White Mountains for a 5-minute doctor's appointment, you can stay in your own community. We should put our face up against the window, right? Well, thank you all so very much for coming. I really appreciate you stopping by, and please do have a great rest of the day and take a look at all of the things that I talked about and see if there's anything that you'd like to pursue. I wish you all the best of luck, and again, thanks. You bet.
After speaking, I think you'd be awesome with commanding our crowd.
I don't know if I have my business. Oh, I do.
Can I take a...
Can you send me an email?
Oh, yeah, definitely.
Perfect. March 6th, I'll check my schedule. I'd love to do.
But I mean, we're just a soft start for us to see how we look.
Well, great to meet you.
Same, thanks so much.
Can I have your card too?
Sure.
You guys can come to Tucson High or just across the street.
Oh, I'd love to.
Talk to our kids. Maybe we'll have a fair or something like this, but there.
Oh, that'd be great.
Yeah, an idea.
Thanks. You bet.
You did a good job. That
Oh,
was
thank
so
you.
interesting.
Thank you.
Thank you.
Thanks for coming.
What is this?
Health careers of the future.
When's it starting?
Did I just give that away? No. 11:10. Yeah, 15 minutes.
Where are the other workshop areas?
There's one back there, and I'm not sure where the other one is.